Your kidneys are crucial filters that clean your blood, control blood pressure, and help make the hormones your body needs. When these hard-working organs get damaged by medications, it can lead to serious problems like rising creatinine levels, protein in urine, and even kidney disease. Many people take medications daily without thinking about how they might affect their kidneys. While medicines are necessary for treating many conditions, some can harm your kidneys, especially when taken for a long time or incorrectly. Knowing which medications pose risks can help you protect your kidney health. Here are 7 common medications that can damage your kidneys. While these medications help treat certain conditions, they need careful monitoring to prevent kidney damage. So stay tuned to keep your kidneys in top shape. Number 7. Non-steroidal anti-inflammatory drugs. NSAIDs, which include common over-the-counter pain relievers like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin, as well as prescription medications like celecoxib, Celebrex, and diclofenac, are among the most widely used medications worldwide for managing pain, inflammation, and fever. These medications are effective in providing relief from pain and inflammation, but their regular or high-dose use can pose significant risks to kidney health. NSAIDs work by inhibiting the production of prostaglandins, compounds that are essential for maintaining proper blood flow to the kidneys. By reducing prostaglandin levels, NSAIDs decrease blood flow to the kidneys, which can impair their function and lead to acute kidney injury or worsen pre-existing kidney conditions. Kidney damage caused by NSAIDs occurs through 2 primary mechanisms. First, by reducing blood flow, NSAIDs can cause oxygen deprivation in kidney tissues, leading to cellular damage. Second, they can provoke allergic reactions within the kidney, resulting in inflammation and damage to the filtration structures. This damage is often subtle and may not present any noticeable symptoms until significant harm has already occurred, making early detection challenging. The risk of kidney injury increases with long-term use more than 7-10 days, high doses or existing kidney problems, dehydration, heart failure, or liver disease. Older adults, particularly those over 65, are especially vulnerable to kidney damage. The risk is also higher for individuals who use multiple NSAIDs simultaneously or take other medications that put additional stress on the kidneys. Studies have shown that regular NSAID users have a 3-4 times greater risk of developing acute kidney injury compared to non-users. Therefore, while NSAIDs are effective for pain relief, caution is necessary, particularly for those at higher risk, to avoid potential kidney damage. Number 6. Certain antibiotics. While antibiotics are essential for treating bacterial infections, certain types can strain the kidneys and cause damage. Aminoglycosides, gentamicin, terbramycin, amikacin, vancomycin, sulfonamides, some cephalosporins, and fluoroquinolones are known to be particularly harsh on kidney function. These antibiotics can directly damage kidney structures, especially the tubules where urine is formed and concentrated, leading to a condition called acute tubular necrosis. This can result in acute kidney injury, which may be temporary or in severe cases, permanent. Aminoglycosides are especially notorious for causing kidney toxicity. Studies show that up to 25% of patients receiving these antibiotics for more than 7 days develop some degree of kidney impairment. These drugs accumulate in kidney tissues, where they damage the cells responsible for reabsorption and secretion of substances, thus impairing kidney function. Vancomycin, commonly used to treat serious infections, can also cause kidney damage, particularly when blood levels become excessively high. This damage often occurs through inflammatory processes in the kidneys. The risk of kidney damage from these antibiotics is significantly higher in certain populations, including those who are dehydrated, elderly, have pre-existing kidney disease or diabetes, or are taking other medications that affect kidney function. When multiple kidney toxic medications are used simultaneously, the risk of damage increases exponentially. Even individuals who are otherwise healthy can develop kidney problems if they are given high doses of these antibiotics or if their treatment course is prolonged. To reduce the risk of kidney damage, it's essential to maintain proper hydration and follow dosing instructions carefully when prescribed these antibiotics. Healthcare providers often monitor kidney function through blood tests, especially in high-risk patients, to detect early signs of damage. Number 5. Proton pump inhibitors. PPIs are commonly prescribed medications used to reduce stomach acid production for conditions like acid reflux, heartburn, and ulcers. Popular examples include omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, Protonix, lansoprazole, Prevacid, and dexlansoprazole, Dexilant. While these medications effectively treat acid-related conditions, research has linked long-term PPI use to an increased risk of chronic kidney disease and acute kidney injury. A 2016 study published in JAMA Internal Medicine found that PPI users had a 20 to 50% higher risk of developing chronic kidney disease compared to non-users, with the risk increasing with longer duration of use. The exact mechanism isn't fully understood, but PPIs may cause subtle inflammation in kidney tissue over time, potentially leading to interstitial nephritis and chronic kidney damage. This inflammation can progress silently, gradually reducing kidney function without obvious symptoms. Some patients may develop an allergic-type reaction in the kidneys called acute interstitial nephritis, which can cause more sudden kidney function decline. The risk appears to increase with longer duration of use, particularly daily use for more than a year and with higher doses. People who take PPIs may develop kidney problems without obvious symptoms until significant damage has occurred, making regular kidney function monitoring important for long-term users. Warning signs may include changes in urination patterns, unexplained fatigue, swelling in the legs or feet, or foamy urine indicating protein leakage. Studies suggest that some kidney damage may persist even after stopping the medication, highlighting the importance of using these drugs only when truly necessary. Number 4. ACE inhibitors and ARBs. Diuretics are medications used to help remove excess fluid from the body, treating conditions like high blood pressure, heart failure, and edema swelling. While they are valuable tools in managing these conditions, certain diuretics can negatively affect kidney function when not used properly. There are three main types of diuretics: loop diuretics, for example, furosemide Lasix, bomenide, torsemide, thiazide diuretics, for example, hydrochlorothiazide, chilorthalidone, metalazone, and potassium-sparing diuretics, for example, spironolactone, eplerenone. Each works by blocking different aspects of kidney function to increase urine output, but they can put a strain on the kidneys under certain circumstances. Loop diuretics are particularly potent and can lead to dehydration and electrolyte imbalances, which can cause harm to the kidneys. They work by blocking sodium reabsorption in the loop of Henle, a part of the kidney tubule, increasing water elimination. Excessive diuretic use can lead to dehydration, reducing blood flow to the kidneys and potentially resulting in acute kidney injury. This is a significant concern for elderly patients who often have reduced kidney function and may not feel thirsty, leading to inadequate fluid intake and further kidney strain. Diuretics can also cause significant electrolyte imbalances, especially low levels of potassium, sodium, and magnesium. These imbalances can hinder the kidney's ability to concentrate urine and regulate acid-base balance in the body. Potassium-sparing diuretics, in contrast, can lead to dangerously high potassium levels, especially in individuals with pre-existing kidney disease. The risk of kidney damage is higher when diuretics are used in high doses, combined with other medications, or in elderly individuals who already have reduced kidney function. Close monitoring is necessary, particularly when multiple diuretics are used together to prevent kidney complications. Number 3. Certain diuretics. Diuretics are valuable medications used to remove excess fluid from the body and treat conditions such as high blood pressure, heart failure, and edema swelling. However, certain diuretics can affect kidney function when used improperly. There are three main types of diuretics: loop diuretics, e.g., furosemide Lasix, bometanide, torsemide, thiazide diuretics, for example, hydrochlorothiazide, chlorthalidone, metalazone, and potassium-sparing diuretics, for example, spironolactone, eplerenone. Each type works by blocking different aspects of kidney function to increase urine output, but they can stress the kidneys when not used appropriately. Loop diuretics are particularly potent and can lead to dehydration and electrolyte imbalances, which can in turn damage the kidneys. They work by blocking sodium reabsorption in the loop of Henle, a part of the kidney tubule, thereby increasing water elimination. Excessive diuretic use can cause the body to become too dehydrated, reducing blood flow to the kidneys, potentially resulting in acute kidney injury. This is especially concerning for elderly patients who often have reduced kidney function and may have a diminished sense of thirst, leading to inadequate fluid intake. Diuretics can also cause significant electrolyte imbalances, particularly low levels of potassium, sodium, and magnesium. These imbalances can negatively affect the kidney's ability to concentrate urine and regulate acid-base balance. Potassium-sparing diuretics, on the other hand, can lead to dangerously high potassium levels, particularly in individuals with existing kidney disease. The risk of kidney damage increases with high doses of diuretics, the combination of multiple diuretics, and in elderly patients who already have compromised kidney function. Close monitoring is essential, especially when multiple diuretics are used together, to avoid harmful effects on kidney health. Number 2, certain chemotherapy drugs. Chemotherapy is often life-saving. It's aggressive because it has to be, but with that power comes a price, and sometimes the price is paid by your kidneys. Drugs like cisplatin, carboplatin, methotrexate, ifosfamide, and pemetrexed are some of the biggest offenders when it comes to kidney toxicity. These medications are incredibly effective at targeting cancer cells, but they don't always spare the rest of your body. And your kidneys, being the primary filter for your blood, take a heavy hit, especially with repeated or high-dose treatments. Cisplatin is one of the most well-known culprits. Research shows that nearly 1 in 3 patients on cisplatin ends up with some form of kidney injury. This drug tends to attack the proximal tubules in the kidneys, the very structures responsible for reabsorbing vital nutrients and regulating what gets eliminated. When these tubules are damaged, it's not just about reduced kidney function. You can also face electrolyte imbalances, protein loss in urine, and long-term complications that may not fully reverse. Then there's methotrexate, especially at high doses. It can crystallize in the kidney tubules, physically blocking them and preventing proper filtration. This crystal buildup can lead to acute kidney injury, and without quick intervention, it can spiral fast. Ifosfamide and pemetrexed carry their own risks as well. Ifosfamide in particular can damage the urinary tract lining, sometimes even causing blood in the urine or bladder inflammation. The risk goes up significantly if you already have kidney issues, are elderly, dehydrated, or dealing with other health conditions like diabetes or high blood pressure. And when chemotherapy drugs are combined, which they often are, the potential for kidney harm increases dramatically. That's why kidney monitoring is absolutely essential during chemo. Blood tests to track creatinine levels, hydration support, and adjusted dosing all play a huge role in preventing irreversible damage. Bottom line, chemotherapy saves lives, but protecting your kidneys during the process isn't optional. It's part of surviving well. If you or someone you love is undergoing cancer treatment, make sure kidney function is part of the conversation. Because beating cancer shouldn't come at the cost of another vital organ. Number 1. Contrast dyes for imaging. Now, here's one that most people don't even think about, but absolutely should. You're lying on a table for a CT scan or an angiogram, and the technician says, "We're just going to inject a contrast dye to help us see things more clearly." Sounds harmless, right? It usually is. But for your kidneys, that contrast dye can sometimes be a nightmare waiting to happen. These dyes, usually iodine-based, are injected directly into your bloodstream to help highlight blood vessels and internal organs during imaging scans. The problem is, they don't just vanish afterward. They have to go somewhere, and that somewhere is your kidneys. These hard-working filters are suddenly forced to process and flush out a foreign substance fast and in large volume. For some people, that's all it takes to push their kidneys into trouble. The condition is called contrast-induced nephropathy, or in short, CN. It's a type of acute kidney injury that can show up within 48 to 72 hours after the scan. What's happening behind the scenes is this. The dye causes blood vessels inside your kidneys to constrict. Less blood flow means less oxygen, and without oxygen, the cells inside your kidneys start to suffer. On top of that, the dye itself is toxic to the delicate tubular cells inside your kidneys. So now you've got reduced blood flow and direct cellular damage. It's a double punch. In most healthy people, the kidneys bounce back within a week or two. But if you already have kidney disease, high blood pressure, diabetes, heart failure, or you're just older and dehydrated, that dye could do lasting damage. In worst-case scenarios, it can even lead to permanent kidney failure that requires dialysis. And here's the part that surprises a lot of folks: even one dose can be enough to trigger it. Statistically, about 2% of the general population might experience CNN. But for high-risk groups, that number jumps sometimes up to 30%. That's a huge leap. And the more contrast you get, say during repeated scans, the higher the risk becomes. Bigger doses, higher stakes. The good news? There are precautions. Doctors often preload high-risk patients with IV fluids before and after the procedure to help the kidneys flush the dye out faster. Sometimes they'll also prescribe protective meds like N-acetylcysteine, and they'll always try to use the lowest contrast dose possible. Some of the newer low-osmolality contrast agents are designed to be gentler on the kidneys, but even then they're not risk-free. So next time you're told you need a scan with contrast, ask the important questions. What's the risk for you personally? Are there alternatives? What can be done to protect your kidneys? Because one scan shouldn't cost you your kidney function. And that's it for today's video, guys. Hope you've enjoyed watching it. We tend to think of medicine as the fix. You get sick, you take a pill, and that pill makes it better. But what we rarely think about is what else that pill is doing, silently, slowly, beneath the surface. The truth is, some of the most commonly prescribed and even over-the-counter medications come with a hidden cost. Your kidneys. These bean-shaped organs don't get enough credit. They quietly filter every drop of blood in your body, nearly 50 gallons a day, and they do it without asking for anything more than a bit of hydration and a little care. But we don't always give them that. We pop ibuprofen like candy. We take acid reducers every morning with our coffee. We go through rounds of antibiotics or get a scan with contrast dye and never ask how our kidneys are holding up. The reality? You can do everything else right. Eat clean, exercise, sleep well. But if your meds are silently wrecking your kidneys, you won't feel it until it's too late. This isn't about fear. It's about awareness. Not every medication listed here needs to be avoided, but they do need to be respected. Talk to your doctor. Ask questions. Don't just refill that prescription year after year without checking how your kidneys are doing. And if you're on more than one of these meds, that's your sign to take it seriously. Your kidneys won't send you a warning text. They'll just keep working until they can't. Don't let it get there. Remember, your health matters. Well, as we always say, in the end, before following any of our suggestions, please consult with your doctor. While we are not medical professionals, we are passionate about promoting healthy living and providing information to help you make informed decisions for your well-being. And be sure to like, share, and subscribe to our channel for more health-related content. Thanks for tuning in with us, and we'll see you pretty soon in the next one.